Hi there, Dr. Sadaf Qureshi here, and today we are going to talk about openings in cranial cavity. There are openings in cranial cavity that pass a structure from the brain and to the brain. The opening in cranial cavity, we will understand this in sections. Like we will first talk about opening in anterior cranial cavity, then opening in medial cranial cavity, and then we will talk about opening in posterior cranial cavity. So let's start our topic with the first topic, and that is opening in anterior cranial cavity or opening in anterior cranial fossa. The first opening we have is foramen cecum, that is present behind the foredental crest. Cecum means blind, so no structure passes through it, but in 1% of population they are patients, so foramen cecum passes nasal imagery vein in that 1% of population. The other opening we have in anterior cranial cavity is anterior ethmoidal foramen that passes anterior ethmoidal artery, anterior ethmoidal vein, and anterior ethmoidal nerve. The other next opening we have is a third opening we have in anterior cranial cavity is middle ethmoidal foramen that passes middle ethmoidal artery, middle ethmoidal vein, and middle ethmoidal nerve. The fourth opening we have in anterior cranial cavity is posterior ethmoidal foramen that passes posterior ethmoidal artery, posterior ethmoidal vein, and posterior ethmoidal nerve. So this was all about the openings in anterior cranial cavity. Now we will talk about openings in middle cranial cavity. Openings in middle cranial cavity, first we have is optic canal, that is inferior medial to anterior clinoid process, and it transmits the optic nerve and the ophthalmic artery, that is branch of internal carotid artery, to the orbit. The second opening we have in middle cranial cavity is superior orbital fissure. That is a slit-like opening between the lesser and greater wing of sphenoid, and it transmits the lacrimal nerve, frontal nerve, trochlear nerve, oculomotor nerve, nasociliary nerve, abducent nerve, and a vein, that is superior ophthalmic vein. The third opening we have in middle cranial cavity is foramen rotundum, that is situated behind the medial end of superior orbital fissure. It perforates the greater wing of sphenoid. As you can see, the orange bone here in diagram is sphenoid bone, and we can see there it is perforating the greater wing of sphenoid, and it transmits the maxillary nerve from the trigeminal ganglion to the pterygopalatine fossa. The fourth opening we have in middle cranial cavity is foramen ovale, that is lie posterior lateral to the foramen rotundum, and it perforates the greater wing of sphenoid. It transmits the mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. Then the fifth opening in the middle cranial cavity is foramen spinosum, that lies posterior lateral to foramen ovale. It perforates the greater wing of sphenoid, as you can see there, and it transmits the middle meningeal artery from infratemporal fossa into the cranial cavity. It is named because it is very close to the spinous sphenoid when seen from the base of skull, so that's the reason it is called as foramen spinosum. The sixth opening we have in middle cranial cavity is foramen lacerum, that is large and irregularly shaped foramen. Its foramen lacerum lies below the apex of the petrous part of the temporal bone and the sphenoid bone. The inferior opening of the foramen lacerum is filled by cartilage and fibrous tissue, and only small blood vessels pass through the tissue from the cranial cavity to the neck. Then the seventh opening we have in middle cranial cavity is carotid canals, that opens in the side of foramen lacerum above the closed inferior opening. The internal carotid artery enters the foramen through the carotid canal. Then we will talk about opening in posterior cranial fossa or posterior cranial cavity. The first opening in posterior cranial fossa we see is foramen magnum, that occupies the central area of floor, and it transmits the medulla oblongata and its surrounding meninges. It also transfers or transmits the ascending spinal parts of accessory nerve to vertebral arteries. The second opening of the posterior cranial fossa is foramen hypoglossal foramen, that is situated above the anterior lateral boundary of foramen magnum and also called as anterior condylar canal. It transmits the hypoglossal nerve. Next opening in the posterior cranial fossa is posterior condylar canal. It is not constant as it is not seen in all the skulls. If present, it passes emissary veins of sigmoid sinus. The fourth opening we have in posterior cranial cavity is jugular foramen. It lies between the lower border of the petrous part of temporal bone and the condylar part of occipital bone. It transmits the following structure from before backward: the inferior petrosal sinus, Then it transfers ninth cranial nerve, 10th cranial nerve, and 11th cranial nerve, and large sigmoid sinus. The fifth opening in posterior cranial fossa is internal acoustic meatus. That basically pierces the posterior surface of the petrous part of temporal bone, and it transmits the vestibulocochlear nerve and motor and sensory roots of facial nerve. So this was all about openings in all cranial cavity. We talk about openings in anterior cranial cavity, then we talk about openings in middle cranial cavity and posterior cranial cavity. Thank you for watching. If you like our video, don't forget to like, share, subscribe and comment.